Hi, everybody. This is Russ Horrowitz. I am the Director of Emergency and Critical Care Ultrasound at Lurie Children's Hospital in Chicago. I have had the unique opportunity to work with both the Butterfly IQ and then the new version IQ Plus, and took the opportunity with the new device to make a comparison of the same patient with the two devices. So now IQ Plus has a smaller probe head, has a little bit shorter and a removable cord to change from USB-C to a lightning cable, which increases its flexibility to use in a number of devices. And the idea of also a prolonged battery life with less overheating, all these combined make these things incredibly beneficial for pediatric imaging. So let's go with these different studies here. We see the IQ images, which will appear on the left, and those on the right. And when I look at these, I try to maximize on the same patient our gain with TGC to get them as good as possible. And I got to tell you, these look at least the same to me. Perhaps there's a little bit more visualization right in here of a little bit of the aortic valve coming into view, which says to me things perhaps are a little bit more sensitive with the IQ Plus. And I've looked at these images over and over, and there's a couple little subtle details that are coming out from me as well. Then the next one is using some color flow to see about frame rate and see about sensitivity. And they look really great to me. There's no significant difference here. I don't see any image degradation with the new chip. Here's a parasternal short axis view. And once again, both are incredibly clear. And I can see good visualization as I scan all the way through. Nice appearance to the myocardium and the bileaflet mitral valve. Moving on to the apical 4. Apical 4, just because of the size of the probe face in the children, it's always a little bit tough because once you drop the tail of the probe, then you inevitably lose a little bit of contact with their chest just because there's so little soft tissue. That being said, I have a nice clear visualization of the interventricular septum, tricuspid and mitral valves, and apex of the heart. That part gets a little blurred out, but that's just because the children are so small and we're losing a little bit of contact there. Moving on to a fast view, right upper quadrant. Seems really crystal clear to me on both the IQ and IQ Plus. And I can see nice view of Morrison's pouch on both devices, clear view of the diaphragm, deep to the diaphragm, so a nice clear here of the thorax to help me exclude the possibility of a hemothorax. Left upper quadrant. Once again, nice clear view as we make our way through and scan all the way from superior pole to inferior pole. And everything to my eye looks really pretty similar. Here's a subxiphoid view in the IQ, interventricular septum, good cardiac motion. This image is just reversed because I reversed the orientation of the probe. But we can see good clarity bilaterally, or not bilaterally, sorry, good clarity on both devices and good visualization of the posterior pericardium to aid in visualization of any pericardial fluid. Next, moving on to gallbladder view. And just to see here that we have that fold in the gallbladder, which comes in with both devices. Nice echogenicity appearance of the liver on the left of the screen. Full stomach coming into view on the right of the screen. And we do have a little bit of the IVC peeking through on both sides with similar visualization. And then moving on to an IVC view. On both devices, we see clear visualization of the IVC and the hepatic vein coming into view. And perhaps I see a little bit more branching here with maybe a little bit more increased sensitivity, but that just might be a little bit of a difference in scanning through. Now the lung view, although subtle, is one where I do appreciate a little bit more difference. And I've noticed this going forward with the IQ Plus, that I do get to see some more comma tails with perhaps a better visualization of that slide. And then Msk Imaging, so this is a hip view, as one would search for signs of a hip joint effusion. Nice visualization of the psoas muscle with both devices. Perhaps this one is a little undergained, and that's why we have a slight difference in appearance here. Here's a still of each of those images. And I think in my eye, although there's a slight bit of difference between the two, I don't think it correlates with any improved quality. One thing that actually is incredibly important is there's a specific setting on both the IQ and the IQ Plus for an adult cardiac setting and a pediatric cardiology setting. And the big difference there is where the image appears on the ped side, we have a wider footprint to start, whereas a narrower footprint here on the adult side. And that allows us for a bigger visualization of the right ventricle. With this cone appearance here on the adult imaging, it's just really kind of limited. And I think some people are impressed with the size of an IQ and IQ Plus, but this was a 1,500 gram baby in the NICU that I imaged the other day. And even at 1,500 grams, about 3 times the size of the probe itself, there's some nice clear visualization of all 4 chambers in this apical 4 view. And then this view, as we roll through one more time, we can see here, heart on the left, and an IVC with its collapsibility. And although small, remember these babies are teeny tiny, so the visualization can be limited, but once your eye gets kind of used to that, and if you did use the zoom in feature, we can get an even better appearance of that IVC and a nice visualization here, even true of the hepatic vein coming right off there. So in summary, I think what we've been able to see here is that we have all the benefits of a handheld device with the new IQ Plus, with improved battery life, less heat, and a smaller footprint, all without sacrificing image quality.